COVID-19 has been impacting the world for over a year and a half now, from schools closing to mask mandates to a worldwide vaccine rollout. The southwest corner of Indiana has officially lost over 1,300 people due to COVID-19. So where do we stand now in the trajectory of this worldwide pandemic? Have we seen the worst of it? Data researchers and local health officials join us to discuss COVID-19. That's coming up next on Newsmakers, presented by WNIN and the Evansville Courier and Press. We've gathered a few experts to discuss where we stand locally with COVID-19. Our first guest is one of Indiana's leading COVID-19 data researchers, Dr. Micah Pollock, an associate professor of economics and the director of the Center for Economic Education and Research at Indiana University Northwest. Dr. Pollock brings his analysis to more than 4,500 Twitter followers. He was a COVID-19 featured expert by IU in 2020 and a finalist for the prestigious COVID-19 Data Heroes Award. He's appeared regularly to analyze COVID trends on statewide and national outlets such as the Indianapolis Star, NPR, the Associated Press, and the Evansville Courier and Press. Dr. Pollock, welcome to Newsmakers.
Thank you for having me, Tom. It's nice to be here.
Dr. Pollock, cases are down here in Vanderbilt County from about 1,300 in the third week of August to fewer than 400 last week. And so the Delta variant fueled surge is down. And to establish that in the beginning, statewide as well.
I think you guys in the Southwest have more or less been following along with the statewide trend, sometimes a little bit more severe. But the whole state is more or less gone in the same direction as Southwest Indiana.
Well, there's an interesting comparison to be made with last year. Tell us about that.
Yeah, so last year around June, we started to see cases increasing. So we had a small wave last year that went from June through September into early October. And this year we saw a similar wave, but it was much larger, primarily due to Delta. More contagious. Even though we had lots of people vaccinated, now it was spreading more among kids, and it just spread more easily. And so you could draw a parallel between the wave we're just getting out of now and the small wave we had last summer. The problem is going forward, last year around this time, we entered into the really big winter wave, that was the worst of the entire pandemic. And so the real question is, this last wave we just got out of, was that kind of instead of the big winter wave, or was that just the wave before the big winter wave?
Well, it wouldn't necessarily be a surprise for us to have another increase in cases as fall and winter comes. And if we do, I would imagine that a key number to know would be the number of people over the age of 65 who are as yet still unvaccinated. And, trying to figure out how many people that is in Vanderbilt County, at least, is a data issue, isn't it?
Yeah. One of the big differences from last year is that last year no one was vaccinated. This year, the age group that contributed the most to deaths in the entire pandemic was those over the age of 65, and that demographic is very heavily and very widely vaccinated. Like you said, it's going to be difficult to give you an exact number of how many people are still unvaccinated and over the age of 65, but we can say that almost all of them are vaccinated. The amount that are left over might be anywhere from 10% to 15%, or maybe as low as 5%, but the vast majority are vaccinated, and that should make a huge difference going into this winter wave. And even if we have a wave, which I think we will, I expect it'll be much smaller than last year, and maybe even smaller than this wave we just got out of as well.
And people in Indiana can go to other states and get vaccinated. And would we always know about that?
It depends on the state. Illinois has a reciprocity agreement where if an Indiana resident goes and gets vaccinated in Illinois, the state health department there is supposed to notify Indiana, and that's supposed to get entered into the system as well. but not all states do. So especially early on in the vaccination process, if people were going down to Florida, snowbirds were going down to Florida getting vaccinated there when they didn't have residency requirements. It's not clear if those numbers ever made their way back to Indiana. And so, in some sense, we may be undercounting the number of people fully vaccinated. And that's especially true if you're looking only at the state data, because there are federal programs, Veterans Affairs, long-term care facility programs that are run by the federal government that may also not be reflected in the state numbers. And so all of these things kind of make it difficult for us to kind of nail down the exact number of people that are left unvaccinated over the age of 65. But that number is pretty small, probably somewhere between, maybe 2,000 to 7,000 or so, if I had to guess.
Mm-hmm. I wouldn't think that a substantial rise in cases would be followed by a similar rise in deaths as last year.
Yeah, one of the confusing parts about this entire process with vaccination is kind of the emphasis on and discussion of breakthrough cases. Vaccines help your body, defend against a virus, but they don't mean that you cannot get infected. And so what we're seeing now is, because so many people are vaccinated, people are getting exposed to the virus and getting infected. Yes, with the vaccine, they're having shorter periods of infection, less severe infection, much less likely to be hospitalized or die. But they're still going to get infected for some period of time, probably a lot less, and probably be much less severe. And so when we see case numbers rising now, there's going to be a disconnect between cases and deaths, in a way that didn't happen before. Previously, last year around this time, a certain percentage of cases resulted in deaths. This year, that percentage is going to be much lower. And so if cases start to rise, we probably won't see as big, if even any significant rise in deaths following that, unlike last year.
So we are likely to see a pediatric vaccination campaign kick off in late October or early November if Pfizer can get regulators to okay the nation's first COVID-19 vaccination for kids 5 to 11. But the uptake among adolescents from 12 to 15 has not been really high in Indiana, has it?
No, statewide, about 33% of those from, I believe, 12 to 15 are currently fully vaccinated, which is relatively low. Just for comparison, when we look at those that were over the age of 80 that we started to vaccinate first, in December or actually early January of 2020, it just took 2 weeks for us to vaccinate a third of everyone over the age of 80. And now it's been 5 months that we've been vaccinating adolescents, and we're just now getting to a third. And so there's much less interest and kind of motivation on the part of parents to vaccinate their kids. And I can understand that, because kids are at a much relatively lower risk of developing COVID. Now that's changed some with Delta, but if you view your risk as lower, you're going to be less motivated to go out there and get vaccinated.
So pediatricians' offices are, I would guess, likely where most of these vaccinations would take place. Sounds like you don't think they really need to gear up for a huge, big uptake among young kids.
I think there will be a big kind of surge in vaccinations among young kids once they become eligible. I, along with a lot of other parents, are just waiting to get our kids vaccinated because we see cases in the schools, and we want to take steps to protect them. And so there's a lot of us that are just would go today and get our kids vaccinated if we could. And so I think you'll see a big surge for at least the first few weeks, maybe a month or so, after the kids become eligible. But I think once you've kind of gone through the people that really want to get their kids vaccinated and decide it's worth it for them and it's the right decision for them, you probably will see a kind of pretty quick drop off in vaccination rates.
Well, you're an unabashed advocate of vaccination. What, in your opinion, is the biggest, best reason for parents to get those young kids vaccinated?
Yeah, so if we didn't have the Delta variant around here, I probably wouldn't be as strong an advocate for vaccines. If we were dealing with the original strain of the virus, it really didn't infect kids that much, and it probably was less worrisome and severe than maybe a bad flu season. But the Delta variant really has changed things. It's just so much more infectious, and kids that kind of got a free pass the first time around now are getting infected. We're seeing cases in schools already, just a couple months into the school year that are higher than all of last school year. We're seeing hospitalization rates among kids that are setting records. And we're seeing deaths among kids. Half of all the deaths that have occurred among kids have been in the last few months. And so I think the Delta variant has really changed things. And nobody likes getting vaccines, and kids least of all like getting a shot. But I think that with the Delta variant, it's become more deadly, more risk of long-term health conditions, more risk of exposure, more risk of infection. And so you have to take that in consideration when you think about the possibility of vaccinating your kids. And I think now that because these things have changed, it's much more important to vaccinate kids than it would have been a year ago.
Statewide, what is Indiana's vaccination rate in terms of fully vaccinated and at least a first dose compared to other states like, for example, Kentucky?
Yeah, if you look at our neighboring states, Kentucky, Ohio, if we include Wisconsin in there, Illinois, we're the lowest among all the neighboring states, not by a huge fraction, 2 or 3 percentage points. I don't have the numbers in front of me, but I think we're about 47% fully vaccinated, 48% fully vaccinated, whereas the other states around us are, 50, a little bit over 50%. So we're definitely behind all the other states around us, which is disappointing. But we're all kind of in a similar ballpark for the most part. We don't really have any states around us that are pushing 60, 70, 80%. Like some of the New England states might be.
What do you attribute that to?
Obviously, this entire virus and the vaccination and the vaccines have been politicized heavily, so there's a component of that as well. There's also just less interest in reducing the spread because, in some sense, we haven't really experienced as bad outbreaks as some of the other places. Now, Southwest Indiana has kind of been an exception because you guys were hit very, very hard last year, right around the time the vaccines were coming out. And for a long time, Vanderbilt County was one of the counties leading the state in vaccination rates.
Yes.
And so if it affects you personally, you're much more likely to take it seriously. If you know someone that's been hospitalized or died from the virus, you're much more likely to take it seriously than if you don't. And so I think for the most part, Indiana hasn't really had a disastrous outbreak like some other states have, that have grabbed media attention, like Florida and kind of some of the upper Midwest states. And so I think that maybe we just don't see it as a big a concern as some of these other states that have had more firsthand knowledge and experience with it.
As we look ahead over the next few months, is there anything that jumps out at you that you and I haven't talked about this morning that people need to know about?
I think you have to remember that the end is in sight. The vaccines are a huge tool towards ending this being something that we worry about on a regular basis. And once we get to the point where everyone is eligible, once we've approved the vaccine for kids and you have the option of giving the vaccine to your children, I think we're going to see kind of the rhetoric and the concern kind of come down a notch simply because now you have the option to do something. And if you don't want to take that option, then that's your choice. But a lot of the stress that we've had in this last few years is that, we can't vaccinate our kids and we're concerned about our kids and other people's behaviors are going to affect our kids. And once you have the option to get the vaccine for your kids, I think that a lot of that will kind of just melt away because, again, you're free to then take the steps that you want to take to be able to protect your kids. And there's less concern about the behavior of others affecting, your kids and family members.
Dr. Pollack, thank you for coming on and being our guest on Newsmakers.
Thanks for having me, Tom.
Now we're joined by Joe Grease, Administrator of the Vanderbilt County Health Department, and Dr. Heidi Dunaway, Regional Chief Medical Officer at Ascension St. Vincent. Thank you, Dr. Dunaway and Joe, for joining us today.
Absolutely.
Happy to be here.
Dr. Dunaway, how great is the decrease in COVID-19 hospitalizations that St. Vincent has seen?
We are definitely seeing the right trend. Approximately 6 weeks ago, our COVID census in the hospital was about 3 times as high as we are today. So we've seen a pretty significant reduction. The hospital remains very busy, however, for other medical conditions probably related to some of the care we had to delay earlier in the pandemic across the country.
Well, there's a story on courierpress.com this morning on this theme, but when case numbers get low, we know that people naturally have a tendency to want to think that this thing is over. How concerned are you guys about an uptick in COVID cases in the fall and winter? Joe?
Sure. It's always a concern. Obviously, we're getting into flu season. We hope people are getting their flu shots as well. And people are indoors more. Obviously, the holidays are coming. We'll be celebrating Halloween, Thanksgiving, Christmas. And we had an uptick last year at that time. So it's a concern. Our numbers are going in the right direction right now, so that's good. Hopefully that trend will continue for our COVID numbers. And if we see an increase in flu or other things, then those things can be handled and we can work through them. But yeah, it's always a concern, and we hope that people continue to get vaccinated and protect themselves in the best ways we know.
Dr. Dunaway?
I agree. I have the same concerns. I think we all share that. We're hoping for the best but preparing for the worst. We hope that the numbers going down don't give people a false sense of complacency. COVID is not going away. It's still around. We're still seeing new infections. So we really have to be working hard on those vaccinations and protecting one another.
Joe, you had a mobile vaccination clinic the health department did at the Fall Festival.
Yeah.
About how many vaccines did you
administer? We did about 10 a day. Some of those were booster shots, but some were new people being vaccinated as well. So we had probably through the week between 50 and 60 individuals that received those vaccinations. Obviously, a lot of people are down there. Would have liked to seen larger numbers, but we're still doing our clinics at the health department. We have the mobile clinic out during the week, so there's still plenty of opportunities. Obviously, both of the hospitals are continuing their clinics and doing a great job in providing that service to people here in our community.
Are you concerned that Fall Festival may lead to an uptick in cases? And if it did, about how long would it take before that uptick was detectable in the numbers?
So anytime we have large groups gathering, it is a concern. And usually, I think it's, and Dr. Dunaway can correct me, but about 10 to 14 days usually after an event like that, we'll start to see those numbers show up, in the daily counts. So we're probably going to be looking later this week into next week and watch those numbers as close as we can.
Dr. Dunaway, you've been pretty clear that you think everyone needs to be vaccinated, but in the event there was another wave of COVID cases, wouldn't the group of people who are unvaccinated and over 65 be the most vulnerable group out there?
Yes, and Tom, what we're seeing even now is that in large part, the number of patients who are hospitalized are those who are unvaccinated and either over 65 or with comorbidities, underlying health conditions or obesity that all put them at higher risk for severe disease or even death from COVID.
Well, Joe, are there any notable demographic differences in vaccination rates in our area?
We still have the younger folks aren't getting vaccinated as much as some of the older population. We can, anybody 12 and up can receive the vaccine, and those numbers in that 18 to 30 range are still lagging. They're getting better, but those are probably the groups that most need to increase those vaccination rates to help us get to that herd immunity here within the community.
I know I did a story a month or two ago in the Courier Press overlaying U.S. Census data on economic status and political precincts and vaccination by zip code, and I found that some of the lower economic areas where income is the lowest are also the lowest vaccinated. Have you found that?
We've seen that as well. The state has their dashboard for vaccinations, and you can look at the different zip codes here in Vanderburgh County and throughout the state. And that's one of the reasons why we've tried to focus in those areas, take our mobile clinic to places within those zip codes to try to be that resource for people in those locations. So it's important to make sure sure everybody has that access. And so that's what we really try to do is focus on some of those areas.
I would imagine you probably never have taken the mobile clinic up to Scott Township or German Township or some of those areas. It's
Not that we wouldn't, but
Right.
yeah, those areas are doing really well. I think 2.5 and 2.0, even close to 80% vaccinated. But yeah, we're going to focus on those areas that maybe have those lower numbers.
Dr. Dunaway, in late September, St. Vincent and Evansville released the statement here that I'll read. There have been 234 patients hospitalized with COVID-19 at Ascension St. Vincent, Evansville between August 1st and September 22nd. 0% of the patients admitted have received at least one dose of the vaccine. I know that, well, first of all, let me ask you, have those numbers kind of held up? I don't know if you have precise data, but has that held up?
Yeah, I don't have the specific numbers today, Tom, but absolutely we are still seeing that by and large, the people that are being admitted to the hospital with COVID or with complications following COVID are those who are unvaccinated. So it's very small numbers. And nationally, it's less than 10% of the hospitalized patients have been vaccinated or even partially vaccinated.
Well, Deaconess Health System regularly publishes information on hospitalized COVID patients and COVID patients on ICU and on ventilators, showing that most of them are unvaccinated. But they're showing more and more breakthrough cases. And so my question is St. Vincent seeing a similar trend?
With respect to breakthrough cases, we're seeing very, very few that require any hospital care. So yes, there are some breakthrough cases that are occurring and that's been borne out nationally, but we're not seeing that in the hospitalized patients.
Do you guys expect to publish an update to your numbers? Do you expect to release more data like that?
I anticipate we will. I don't know at what point we will, but we'll have more of that coming out for everyone to see.
Well, Joe, assuming that federal regulators authorize emergency use of the Pfizer vaccine for kids 5 to 11, later this month or early next month, a pediatric vaccination campaign is going to kick off. Would the health department offer that pediatric vaccine, and where and when?
Absolutely. We're going to take our lead from the state health department. We get the vaccine from them. They have certain guidelines that we have to follow. So we're going to take our lead there, but absolutely I believe we would be part of that resource for the community. We're going to have the ability to vaccinate kids at the health department. People can make appointments, but also we'll be out probably going to schools and offering it through the schools as well. So that's always a good collaboration with the Evansville School Corporation that we have, and if parents want that for their children, we're definitely going to make sure that we're a resource for them.
Dr. Dunaway, would St. Vincent be making that pediatric vaccine available in the offices of its pediatricians, or would people need to come to the hospital's clinic?
Initially, our plans are to have the pediatric patients come through the vaccine clinic. Depending on the directions that we get from the state health department and the specifics of the EUA, that will determine if and when we could roll that out to pediatricians' offices.
What can you tell us at this point about the logistical challenges of mounting a pediatric vaccine campaign? I think that vaccine cannot be taken from your storehouses of existing Pfizer vaccine. Is that right?
Correct. My understanding at this point, the information that's been released, is that the pediatric dose is a third of the adult dose, and it will be packaged in individual vials as opposed to the adult dose, which comes in a multi-dose vial. So we draw 5 or 6 vaccines out of each vial for adults. So they need to be separated. That's also for safety reasons too. So it will be a separate process, and it'll work in parallel to that of the adults.
What about cold storage?
With the long-term storage of the Pfizer vaccine requiring the ultra-cold, that ultra-cold storage is not available in most sites. So there will have to be a process to distribute the vaccine out to the sites that will be giving it if we take it away from the clinic and move it out to the pediatrician's offices. The vaccine also has a limited shelf life. Even if it's kept in a regular freezer approved for vaccines, it will have a limited life that it can be kept at that temperature before it must be discarded.
Thank you. Joe, earlier this week, the county commissioners asked you how much longer you think the mask mandate for county buildings should continue. What did you tell them?
Basically, I mentioned that we're still in the orange. You know, we still see a moderate spread of the disease. We know it's still being transmitted here in our community. Our numbers and our positivity rate hasn't dropped below to bring us into the yellow or the blue. I told them that as the health department, we'd probably recommend moving into the yellow or to the blue before we would make any adjustments for county buildings or city buildings. And I think that's just to make sure that we're doing everything we can to protect people when we're in those enclosed spaces, and making sure that people, because we don't know if they're vaccinated or unvaccinated, everybody wears a mask. It's gonna help protect them.
Is that a decision that the health department makes, or the county commissioners with your recommendation?
That's going to be a decision that commissioners would make in conjunction with our recommendation, yes.
Well, I've got a question now for both of you, one that everyone really wants to know. We'll start with you, Dr. Dunaway. How do you see the rest of this pandemic playing out? Do we expect more variants? What's the likelihood that we'll need a yearly shot like the flu?
Well, certainly, I'd love to have a crystal ball and be able to give you definitive answers on all of that. We know that with the way these viruses and the specific type of virus that the coronavirus is, it is prone to mutation. So we do anticipate there will be additional variants. They're constantly arising. We don't know exactly how that will play out. I don't think that any of us believe that coronavirus or COVID is going to go away completely. We'll have to remain vigilant, and I suspect we'll see the vaccines evolve over time.
Joe?
It's been a changing world since the beginning of this. Here locally, in the country, throughout the world, it's very difficult to know where things are going to go. I think the best thing we can do is try to prepare ourselves, be ready to adjust, to make changes to our processes, to what we can do to protect ourselves. I think that's the biggest key for us, is just to always be ready and have the ability to make adjustments and take on the challenge as best we can.
Joe Grease, Dr. Heidi Dunaway, thank you for joining us. Thanks to all of our guests for joining us. See you next time on Newsmakers, presented by WNIN and the Evansville Courier and Press.